of Dr. Adesola Olumide. She is a researcher and consultant community physician at the Institute of Child Health in the University of Ibadan and University College Hospital, Nigeria. I am delighted to work with her in the International Association for Adolescent Health, where she is the Vice President for the Sub-Sahara African region. And she's also the current Secretary General for the National Society for Adolescent and Young People's Health in Nigeria. We're really looking forward to hearing your experience, Dr. Olumide. So as a consultant community physician and a researcher, what is your experience with the implementation of school health and nutrition in schools in Nigeria? Thanks so much.
Thank you very much, Sylvia, and thank you very much also to all the other presenters whose presentations have actually set a nice stage for what I'm going to be presenting today. So I'm just going to be sharing some experiences I've had with respect to how school health and nutrition have been implemented in Nigeria. I'll take us through a quick background, mention some of the nutrition policies we have in Nigeria and school health policies, and then give 3 examples of how in Nigeria. At the background, Nigeria is a really populous, and our population of those who are less than 14 years is really considerable. We also know that currently in Nigeria, gross enrollment is not 100 school. We have about 86% as students move from primary school to secondary school, and by secondary school, and this data is from UNESCO. We also know that nutrition really affects the health of school children and of adolescents as well, and some studies have shown us that about 1 in 4 of school-age children in Nigeria are undernourished, and this, we know, has various consequences on them, which are short-term or long-term. And in recognition of this, we had several interventions put in place to try to resolve success. And I like what Professor Castle said earlier on about the fact that it's important that beyond just implementing programs, we need to start looking seriously at how we can sustain these programs. As looking at school health and nutrition policies in Nigeria, the main one really for this is the National School Health Policy. And this policy came into being in 2006, and it is really due, long overdue, for revision. The school health policy in Nigeria is spearheaded by schools. It goes beyond just primary school and secondary school. Usually, we also think about early child care centers. These are kindergartens and nursery schools. And so government is interested in ensuring that these premises are also safe and promote the health and nutrition of children. Then we also have non-formal education centers, things like the nomadic education, continuing education centers where students go to in between schools and the rest of it. These are also included and covered in our school health different aspects. One is that of healthful school environment, school feeding service, skills-based health education, school health services, and school, home, and community relationships. And indeed, when the policy was put together, part of what informed it were the guidelines from UNESCO and from WHO, and so the policy is quite comprehensive. We have the national guidelines for the prevention and control of micronutrient deficiency in Nigeria. We also have the national policy on the health and development of adolescents and young people in Nigeria for adolescents and young people. Then more recently, the Nigerian Homegrown School Feeding Strategic Plan. And all these policies and guidelines help to provide guidance for the different types of programs and policies that we have in the country with respect to school health and nutrition. When it comes to implementation, similar to what happens to the education, Ministry of Health, you have NGOs involved, faith-based organizations. You also have government and private hospitals being involved, academic institutions, food vendors, parents also being involved in the implementation of our school health policy. And for us, the school health policy is spearheaded by the Federal Ministry of Education. And to what extent then has this policy been implemented? I have great all the different components that yes, definitely things have school environments. Most times, oftentimes have better elements at their disposal. Also, as models, the older government schools, you have the alumni associations that contribute to ensuring that the school environment is conducive for learning. The school environment is safe, and the school environment is one. We do have school feeding service as well, and I'll be giving us an example of the Nigerian school feeding program. Then we have school-based health education too. In these components, we have things like the expanded life planning education, which is sexuality education that is taught to adolescents in school. They also have physical and health education, and various health-based topics are taken in schools. In this aspect also, you have the health clubs that you have in a number of the schools as well. So these are various ways through which the health and nutrition of in-school students is taken care of. You have school health services. This varies. Sometimes you have the school nurse in the school. Sometimes you have the sick bay in the school. And sometimes also you have some schools having retainerships with private hospitals in town so that they can take the students there to receive care. Then school, home, and community relationships. This has also been implemented to some extent. Many times what we have here is the Parent Teachers Association trying to see what they can also do to contribute to the health and well-being of their pupils that are in school. So looking at some experiences, I'll be drawing from 3 of them, a little bit of the findings of the study we did to assess it, knowing that the students spend a lot of time in school with their teachers, and that the teachers will have a role to play in ensuring that the students are healthy and that they are well fed. And I'll also talk about our national homegrown school feeding program, and then mention more recently steps that have been taken to implement the WHO school health guidelines in Nigeria. For the school health services, looking at early detection, like I said, we to screen for selected impairments and hyperactivity disorders among some primary school pupils and 40 teachers. And of these, about 55 of them, about 8% of them actually mentioned that the screen people, they did not mention being able to use the Snenos chart, but they looked out for other pointers, other things that they felt could indicate that the child was having problems with vision. And they usually followed up with parents, first of all with the school principal, and then with the parents. And so they recognized that they had a part to play when it comes to early diagnosis of some impairments. With respect to hearing impairments, about 108 of them mentioned that they would have a sense, or they would suspect that the people might have a hearing impairment if the people perpetually gave inappropriate answers to questions. And so they didn't know how to use any of the equipment, but they could tell if a child, or they could suspect if a child had a hearing impairment. And then they would follow up by sending for the parents or reporting this to the head teacher. However, some parents, some teachers were a bit skeptical about this because they said that especially in government schools, when parents couldn't afford to take their people to the students, their children, to hospital, it was a problem when they identified these issues with them, because sometimes the parents would expect that they as the teachers would be the ones to fund. Sometimes they're a bit skeptical about pointing this out. Might be struggling with hearing if the child was well. and the child wasn't responding. Looking at hyperactivity disorders, about some 5% of teachers said that they would consider that the pupil might have an underlying problem that made him or her hyperactive if he or she was excessively restless and had poor concentration. One good thing we noticed about the teachers was that they were hesitant to stigmatize their pupils. However, if they felt that the pupils might have a problem, they were willing to go to the teacher, to the head teacher, to express their concerns and see what the parents will do to take this further. And some of what came up from this study was that teacher skills in early detection can be improved with training, and that teachers are willing to do this because for them, they were concerned that in school should be able to learn maximally in school, and that they understood also that the school environment could be a place where for the very first time an impairment is detected in a child. Now, looking at the National Homegrown School Feeding Program, prior to 2016, we had different types of school feeding programs in schools, different variants of this, and in line with best practices as well, foreign governments also realized that it's important that for children to be able to concentrate in school, for them to be healthy in school, they should be given at least one meal a day. And so this program was launched in 2016, and the aim was, the overall goal was to provide a nutritious and balanced meal to primary 1 to 3 pupils in government-owned primary level, because this actually is a cost-intensive program. Some of the aims of the program were to enhance school enrollment, retention, and completion, to improve nutrition and health of primary school children, also to encourage local agricultural production, because some of the produce that was used to prepare this meal were supposed to be sourced from the local farmers. And so it was sustainability of the program could be enhanced. It was also felt that it was important to try to create jobs for community members, and in this way increase state and national economy. Food, the vendors from the to prepare the meals and serve the meals were drawn from within the community where the schools were located. So how then do we prepare? There have been several short-term evaluations of the immediate impact demonstrated, some short-term successes. And by 2018, it was said that about 10 million primary school children had been reached. An evaluation that was conducted in one of the states where this was implemented, that's in Osun State, showed the improved nutritional status of the pupils. In about 3 of the evaluations that were also conducted, they had noticed that there was improved school enrollment and retention. And indeed, in Osun State, they noticed that many school pupils many parents of school pupils moved their pupils from their children from private schools to government schools because of the 1 meal a day. And there was also increased job opportunity. However, there were also some barriers noticed, and one was inadequate funds. 2 was the fact that people felt there was selective implementation. 1, the fact that it stopped at only primary 3. So in Nigeria, in primary school, there are 6 classes of primary school, primaries 1 to 6. And so people felt that selectively focused was not very good for those in the older classes. And some teachers actually reported that during break, when the primaries 1 to 3 pupils were at the window, and we're also looking and trying to see would this ever get to them. So selective implementation was a problem. In some instances also there was poor coordination. So poor coordination between the vendors, poor coordination between when government was going to bring funds, poor coordination sometimes between the cooks. And so these were some of the barriers that were noticed. However, there have been efforts ongoing as government is preparing to scale up the program. So the final example is looking at the WHO guideline on school health services, and this was recently developed. And so currently, government is trying to see how we can implement this. And so we are still at the basis. Ministry of Education and Ministry of Health we brought together to implement this, knowing fully well that it's not the job of just one ministry. Okay, so it's trying to see how both the Ministry of Education and Ministry of Health could be brought together to work together to implement this program. And one thing they have done is to piggyback on the Technical Working Group for Adolescent Health, because that has representation from various sectors, from Ministry of Education, Ministry of Health, and Education as well. And so in conclusion, we know that health, including nutrition and education, are closely related. And we have had a range of interventions to address school health nutrition in Nigeria with varying degrees of successes. And it's important to ensure sustainability of these interventions so that lasting impact can be attained. Thank you very much.